Let's talk about bipolar disorder. Bipolar is a term that gets thrown around quite a bit. Often people don't even know what it means. You hear people who say, isn't he bipolar? Isn't she acting bipolar? Isn't the weather bipolar? The list goes on and on. I think we really need to be careful when we just throw that word around because most people don't know what it means. It is a mental health diagnosis. It is a clinical term. It means that the person has two poles of their behavior. So up here, they're really high, and we can call that manic, and down here, they're very depressed, and we would call that depression. So the person often bounces between the upper pole and the lower pole. They might bounce quickly, it might be much slower. Maybe they're more on the depressed side than they are up on the high side or the manic side. There's many different ways that a person can be bipolar, but nonetheless, that's the idea. When a person has bipolar disorder, it is a chemical imbalance. It is often hereditary, and it often occurs when they are a teenager or in their early 20s. Usually, if a person has bipolar disorder, you'll see it by age 30. Sometimes it's later, but often between the teen years and about age 30, you will see that happen with a person. So sometimes people with bipolar are so depressed or their thoughts are racing so much that they're unable to work. Other times it's more mild and they work, but yet there's some difficulty in life, like keeping and maintaining friends, keeping your mind focused on the job at hand, and that kind of thing. So I've had plenty of clients that are on disability as a result of their bipolar, and then others are quite functional, and you would never even know it. Many times, a person with bipolar disorder, they need to be on medication. So a mood stabilizer would be the term. That's something just to help to level out the mood. So at the same time, if the person does therapy, then that's very helpful. So a person with bipolar disorder, in therapy, they would be looking at stress management techniques, communication techniques, and just some mood management skills in general. And often when you have therapy and medication at the same time, then that's what the research shows to be the most helpful. Now, it's important to point out that if you have bipolar or if you know someone that does, there is an increased rate of suicide for people in this population. So if anyone is saying that they're feeling suicidal or we have some concerns about that, then nonetheless we need to take them seriously and we need to get them some help. So as far as talking with them, and if we really think that they're going to act on this, calling 911, getting them to the emergency room. Okay? Another thing that we need to look at is that people with bipolar disorder are more likely to abuse substances, whether that would be alcohol or any kind of other drug. So it kind of turns into a chicken and the egg situation of, is the drug use causing the bipolar or is the bipolar causing the drug use? Often it's hard to tell, but if someone is in this situation, you need to talk with them about why don't you go to therapy and get some help, or go to rehab, or talk with your family doctor. Do something to get that person some help. So those are the general ideas about bipolar disorder, and please be careful how you use that term.